Before we get into what actually happened, you need to understand what the world looked like. No roads, no villages, no buildings, just open land, predators in every direction, and a small group of humans trying to survive one more day. Now imagine labor starting in the middle of that world. There is no time to find a safe place. There is no clean environment. There is no warm bed waiting. The body gives a woman maybe hours, sometimes less, and what happens next, in the next few hours, will be the most dangerous experience any human being can go through without a single piece of modern medicine to help. And in those hours, everything that happens next will determine whether she lives, whether the baby lives, or whether neither of them make it through the night. This is a story about survival at its most raw and human. The first problem. The human body was not designed for easy childbirth. Every other mammal on Earth gives birth relatively quickly, relatively smoothly. Horses, elephants, wolves, their young emerge within minutes to hours with minimal complication. But human babies are different, and the reason is something that should genuinely disturb you. Around 2 million years ago, the human brain began growing at a rate unlike anything seen in any other species on Earth. Bigger and bigger with every generation, which meant bigger skulls, which meant at some point the human skull became almost too large to pass through the human pelvis. Almost. It is one of the most dangerous biological compromises in the history of life on Earth. The species that became intelligent almost went extinct because of its own intelligence, and ancient women paid that price with their bodies every single time. So the question becomes, what did they actually do about it? What actually happened? Here is what most people get wrong about ancient childbirth. They imagine a woman lying flat on her back. That is not what happened. That position was actually introduced much later in history, and not for the benefit of the mother. It was introduced for the convenience of the people watching. Ancient women instinctively did something completely different. They squatted. And this is where it gets fascinating, because squatting is not just a position, it is a biological mechanism that the human body actually uses to help itself. When a woman squats during labor, gravity becomes her greatest tool. The baby is no longer fighting upward against the body. It is moving naturally downward in the direction it needs to go. But that is only part of what squatting does. The pelvis, the bone structure the baby must pass through, is not a fixed, rigid opening. It is a structure that can shift and expand slightly under the right conditions. When a woman squats, her pelvis opens up to 30% wider than it would if she were lying flat. 30%. That difference is the difference between a baby that can pass through and a baby that cannot. When things got harder. But squatting and gravity alone were not always enough. Labor in the ancient world could last hours, sometimes an entire day, sometimes longer. And as the hours passed, the woman's body weakened, her muscles exhausted, her breathing ragged. This is when the people around her became everything. In early human communities, women did not give birth completely alone. Other women stayed close, not just for emotional support, but because they had seen this before. They knew what a normal labor looked like. They knew what a dangerous one looked like. They knew the difference between pain that meant progress and pain that meant something was wrong. When the baby's head began to appear, these women would apply pressure, slow the process deliberately, because a baby emerging too fast tears the mother's body in ways that in the ancient world meant death from blood loss within hours. Slow, controlled, guided by hands that had done this before. No textbook taught them this. No professor explained it. They learned it by watching women die when it went wrong, and by remembering everything that happened in the moments before. The moment of birth. When the baby finally came, the cord was still attached. Ancient communities across the world handled this in remarkably similar ways, despite having no contact with each other. They waited. They did not cut the cord immediately. They allowed the blood still pulsing through it to finish transferring into the baby's body. Modern medicine now calls this delayed cord clamping and recommends it as the healthier approach. Ancient humans figured this out by observation alone thousands of years before anyone understood what blood even was. When the cord was eventually cut, they used whatever was sharpest available, a sharpened stone, a shell, a piece of obsidian. The wound was then treated with whatever the community had learned stopped infection: clay, certain plant pastes, ash from fire, which we now know has mild antibacterial properties. Again, no laboratories, no understanding of bacteria or infection as a concept, just thousands of years of watching what worked and what killed.